Feels like mental health and youth mental health may be the next wave of this.
That I think is the next big fight. And on that, I think a lot of the data on this, I think is just not where the narrative is. The narrative, I think the narrative is a lot of people sort of take it as if it's like an assumed thing that there's some link, and I think the majority of the high quality research that's out there suggests that there's no causal connection.
Peds Patrol here, and this is a very hot topic: social media, teenagers, and mental health. So a lot of major tech companies like Facebook, Instagram, Snapchat, and TikTok are being accused of either causing or increasing mental health in teenagers. The challenge is really finding really good evidence to support these claims, because if it does, then it can lead to impactful and meaningful change both at a local and government level. I'll link below meta-analysis studies that were done most recently that looks at social media in adolescence as well as depression and social media influencers. In one study, they looked at children with already pre-existing mental health conditions, children with health conditions that are not clinically diagnosed, and then the general population, and found that with increased social media use, those children who had pre-existing mental health conditions were internalizing more, which means that there were feelings of sadness, depression, and anxiety that were further exacerbated by social media. That study also looked at social media engagement and internalizing symptoms and found a correlation as well. That being said, one of the things that they wanted to highlight in the study is that children who have pre-existing conditions already have challenges with sleep, poor performance, mood, behaviors, and that can change the way that they observe and view social media channels. Therefore, the content that they view and see and observe may actually be different than other teenagers and adolescents who don't have mental health conditions that are looking at social media in a different lens. Another scoping review looked at social media influencers and how they target teenagers in terms of influencing on fashion, on beauty, on weight standards, as well as sexuality and sexual health, and smoking and fitness. What they found in that study was that a lot of social media influencers who are targeting these specific niches don't have either education or the experience to advertise such things, and there is a lot of concerns about being backed by companies in terms of vested interests. This means that teenagers can be influenced with information that's not actually evidence-based, factual, or in their best interests of their health. Overall, what this means that this is a long discussion and a long debate. It will take many stakeholders, parents, school teachers, governments, and tech companies to really figure out the next steps going forward. As healthcare providers, I think it's important to be mindful of these things and provide support and advocacy to our teenagers when they come to clinic.